So when we clip for the female spay, we're going to clip from xiphoid down to pubis in case we need to extend our incision. Some people will only clip just above the umbilicus, but we at UF are going to clip all the way up to the xiphoid, which is usually about the second pair of nipples, or you can feel it right here. When I clip, I like to create a straight line, and a straight line, and then I clip. So I give myself like a little sandbox to play in. So I'm going to demonstrate that here. Ready? All right, so 2 things. When we're doing our dirty scrub in the prep room, when we wipe, before we go to the OR, this gauze should be coming clean. Obviously it's not. So this dog is not ready to go to the OR until I'm wiping this gauze, gently of course, and it's coming clean. When we go to do our sterile scrub, again, we're gonna grab with our non-dominant hand, trade, and then scrub with our dominant hand. So I'm gonna grab here and trade. The classic way to do a sterile scrub is to place your gauze where your incision's gonna lie, and then slowly work your way out in a circular fashion. Notice as I'm working my way to the outside, this edge of the gauze is always staying towards the hair. This edge of the gauze, that's my clean edge, is always staying towards the incision. I'm never gonna go back over my incision line. I'm always gonna keep working my way to the edge, and that edge of my gauze is always gonna stay to the outside. Now, this is a big girl, so she may need a couple pieces of gauze to get my entire surgical field covered. You should be scrubbing and not doing that. Don't ever put your clean hand on your patient. You should be scrubbing your entire surgical field. So there's no point in clipping it if you're not going to scrub it. So make sure you're scrubbing your entire surgical field. The other way that you can scrub, which is the way I prefer to do it, is I like to take my gauze, again, I'm going to switch my hand, and I like to do my patient in quarters. Personal preference, it's a little bit of a waste of gauze, so keep that in mind. But I like to start at the center, drag my piece of gauze down this direction, grab a new piece of gauze. If you can get it to open, that's even better. Drop that gauze on this quarter, scrub down. And then we're going to do the same thing for the top 2 quarters, where we lay our gauze down, scrub up, lay our gauze down from the center, scrub up. So I have 4 different quarters. 3 each. Yep, and we're always going to do Chlorhex, then alcohol, then Chlorhex, then alcohol, 3 times. So Chlorhex, cover the whole belly, then alcohol, cover the whole belly, then Chlorhex, cover the whole belly, then alcohol, cover the whole belly. You don't want to Chlorhex one spot and then alcohol the same spot. You want contact time. The same amount of contact time that you should use total when you're scrubbing your hands, your patient should have. So your total scrub for your patient should be 5 minutes, just as the same as your total scrub for your hands should be 5 minutes. So that means you want to cover your whole belly in Chlorhex, then cover your whole belly in alcohol, then the whole belly in Chlorhex, and then in alcohol. A minimum of 3 times. If you haven't reached 5 minutes yet, you can go ahead and do a 4th scrub. It's not going to hurt. When you're scrubbing, you've already clipped this hair down to the skin. So the skin is going to be very sensitive. It's going to be very likely to get hives, break out in a rash. So I don't want to see people scrubbing on the skin. I know it's called a scrub, but that's not the point. When you're scrubbing your patient, you want to be gently wiping the skin. Doing this is not going to make it any more sterile than gently wiping. And it moves the dirt back and forth. So when I'm scrubbing my patient, again, I'm never going to go back and forth over my surgical field. I'm going to start at my incision line and always move away from it. And I'm going to be gently wiping, not scrubbing.